It's a living laboratory, and we would not be where we are without all of our clinical partners. It's a relationship that, as they invest their time in training our students, they're winning as well because they're coming to work for them at their hospital or not-for-profit organization.
This is Your University, the FGCU podcast, and with me today is Shawn Felton, the Dean of the Marieb College of Health and Human Services here at Florida Gulf Coast University. Welcome.
Katie, thanks for having me. I'm really a big fan of the podcast thus far. I know I got big shoes to fill after watching Win Everham come through, but I hope I can live up to the expectation, but really excited to be here with you all today.
I know, founding faculty member, right?
He was. I came in 2005, so a few years behind.
Yeah, and that's okay. We were still really growing.
We were, and it's been really a lot of fun here at FGCU, and to see the university grow. I just actually had lunch with Roy McTarnigan a couple weeks back. We were reminiscing from all the days of him beginning the university to his support of me as a faculty senate president, board of trustees member, and it was just a lot of great reminiscing. And then Roy is just as sharp as he's ever been. So it was a lot of fun.
And for people who don't know Roy?
Roy was our founding president here at Florida Gulf Coast University. And if you walk around campus, you may find his name on one of our buildings, McTarnigan Hall.
You may. Right.
You may. You got to find it.
Will.
We'll do a scavenger hunt.
Yeah, and you should do a scavenger hunt because we do have a beautiful campus. And if you haven't been here, you need to get here.
It is. It is wakes to one of the most beautiful things each day coming into campus. Just very inviting. And those days when maybe it's not the best day, you get outside and you get right back in a great mood here at FGCU.
Well, speaking of names, we have a beautiful story behind Marieb College, the name. Can you go ahead and fill us in on how it became Marieb College?
Absolutely. It was a great opportunity. Dr. Elaine Nicpon Marieb, she was a textbook author, mostly anatomy textbooks, and she got connected to our university, your university, in 2011 as we were building the then building, Academic Building 8. We have a fun way of naming buildings around here at FGCU. It's AB8, moved to AB9, the water school, and now we're moving into AB10. We'll get into that in a little bit. But it was AB8, and then we moved in January of 2012. And shortly right after, she provided a $5 million gift for scholarships for non-traditional students. And AB8 quickly became Marieb Hall. She continued to grow with us. Then again in 2017, she renamed the college to the Marieb College of Health and Human Services with another $10 million endowment gift. And she saw our potential. She went on to receive an honorary doctorate degree here from FGCU. And unfortunately, she passed about a year after that. But her legacy lives in everything we do each day. I tell the faculty, I tell the students, as you walk through Marieb College, you will feel her presence. Each year we pause just for a moment to remember Elaine and what we call Marieb Day. We do a phenomenal art show. And then that morning, or actually that afternoon, we had a luncheon with many of her scholarship recipients, and you could just feel her presence. So we try to make Elaine proud each day, and I think we are, and it's really exciting for her vision with us. I mean, we were still kind of a startup health college back in 2012, and she saw our potential, and she invested, and so each day we try to make her proud.
Yeah, it's super interesting to me, someone who really had no connection to building this university up from the beginning, before 1997 when it was just a glimmer in our eyes in Southwest Florida, but she heard about us, she came to check it out, and she was impressed. She saw something.
She saw that opportunity, that vision, and our outcomes, and she wanted to invest. And we're a much better college, much better university with her investment, and we thank her still today.
And I want to go back a little bit to Marieb Day. You said you brought in art, right, to help celebrate. We just had a student on here, an art and biology double major, and talking about how they really do intertwine. It sounds like they really do in the Marieb College.
They do, and we have a great faculty member, Dr. Valerie Weiss. She's a physician by trade, but she's also a medical illustration artist. And we've actually launched a minor this past fall 25, in a medical illustration minor. And she had done this in the past as just a class, an honors course. And it really does connect the student with learning by being able to visualize. It's really fascinating, these pictures that these students put into play, anatomical imagery, and it's just absolutely beautiful. When we started this about 6 years ago, we had 30 pieces of art. This past week, over 130 pieces of art that is designed by the students. We provide awards for them, and it just is really a great connection between healthcare, art, and really what Elaine was all about.
And when you walk into Marieb Hall, you will see artwork.
You do. You see pictures of art that was in her textbooks, beautiful sandstone sculptures. And as I said, the building's beautiful, but it's really Elaine's legacy that we live each day as we prepare the workforce for Southwest Florida. We're all going to need healthcare sooner or later, and I just hope all the grudges that students have against me will be taken care of when they treat me out in our hospitals and clinics here.
I'm sure. So I do want to continue on with the Marieb legacy a little bit, because not too long ago, FGCU received its largest monetary donation in its history, $22 million, again, from the Marieb Foundation. Can you explain what that money is going to go to?
We're really trying to move emerging technology, training our students for what they're going to face in healthcare today. Obviously with AI, training, we're really trying to be on the cutting edge so that our students are prepared for the workforce and really support Southwest Florida and beyond after that. So when I went to them, we were explaining this is where we need to go, and that's when the gift of $22 million is coming forward, and it will name AB10. But I think it just really shows the commitment once again of really carrying Elaine's legacy for almost 15 years now. Next year will be 15 years that she was introduced to the institution and provided that first gift, and for them to continue to believe in what we're doing and for it to be the largest monetary gift, I think says a lot about that support, but it also says what the Marieb College of Health and Human Services is doing for our community, ensuring that we have the practitioners, both clinical and non-clinical, that's going to support everyone here in Southwest Florida for the place that we love, and make sure that we have the right health care as well.
We must be doing something right.
We have a lot of great faculty and staff that helps out as well. So yes, we are doing some good things.
So let's back up a little bit, because you mentioned AB10. So when we take a look at the Marieb College, you've got rehab science, counseling, social work, health sciences, and the School of Nursing. Am I missing anything?
You're missing probably one of the big ones is our counseling and psychological services. That's within that supports the entire student body. So typically, that is found in student affairs. About when former President Martin was still here, CAPS was relocated into Marieb College, and we've built some really strong synergies around that. We've had some joint hires where we've been able to hire both a clinician and then also hire an academician as well. So really kind of blending practice with education, having our students being placed in CAPS. And so we're in the process. It'll be launched this fall, providing a new school of combining counseling, CAPS, and social work together. I've hired a new school director this past fall, Dr. Chi-Chen Chu. She comes to us from University of South Florida. So once again, we're really trying to address the behavioral health needs, not only on our own campus, but across Southwest Florida where they're vastly needed as well. We're quite busy. Now with a new building, we'll have some opportunities for growth as well.
And thank you for that transition, because when you take a look at all of these departments and the growth and the need, not just locally, but nationally. And then when you break it down locally, we do have a large retiree population. We do have a growing general population as well. The need for healthcare services is very large, and we've outgrown what we have.
We're at capacity in the current Marieb Hall, and I have faculty and 3 or 4 in an office. They can't wait to move into the new building. We can't get that built soon enough, but what it will allow us to do is it's truly an expansion project for the FGCU and for our College of Health. Great support, though. We would not be here without the great support of our legislation, especially our Southwest Florida delegation, both the Senate and the House. And special thanks to, Kathleen Pasadoma as a Senate president, as she really navigated the opportunity for us to receive the funds for the building.
Because we're a public state university.
We are. And, we hope we are putting your tax dollars at work very well. But it's been great support, and it's because of the outcomes. And it's really exciting that we're being able to produce the type of talent to stay in the area. And many of our individuals stay in the area, both in the undergraduate and then graduate, as students relocate here for grad school in our DPT program, our occupational therapy.
DPT.
Doctor of Physical Therapy.
There you go.
My bad. There's more acronyms in higher education than anywhere. So thanks there, Katie. But occupational therapy, our doctor of nurse practice programs, our masters of counseling, our masters of social work, they stay in the area, and they find a home, and they really contribute to our area to provide the health care that's needed.
Let's talk about that a little bit, because we are a regional comprehensive university, meaning we serve the community. The community came together before 1997 and said, we need a university in our backyard. They made it happen. How have you and your colleagues on campus really gone out into the community to really say, what are your needs? Are we meeting them? How can we pivot to make sure we're continuing to provide those needs? Because we partner with nonprofits, with for-profits, to make sure that we are producing those healthcare practitioners.
Yeah. I think the biggest part is we need them as much as they need us as well. We do a lot of didactic education in the classroom, which is great. But our students are with those clinical partners almost more than they are with us at times, with all of their clinical rotations, internships, fieldwork experiences, whatever that particular program calls that clinical experience.
But all of it's intense.
Very intense. And we would not be the college we are without those clinical partners. So that's probably one of the biggest jobs that I have each day as well, is to maintain those relationships with the C-suites of our hospital organizations, all of the nonprofits. But it's not just me. I mean, our faculty, our clinical coordinators, our fieldwork experience coordinators are out there as well, making those connections to where we have over 1,500 clinical affiliations across, not just in Florida, but across the U.S. And internationally. We have a few in Puerto Rico and in Mexico as well. We have built that relationship, but I think we've also listened. If you look at all of our programs that we offer, it is in what is needed in Southwest Florida to fulfill the workforce needs. Nursing is an obvious one, but physical therapy, occupational therapy. We have built the programs that is needed by the workforce here. As you noted, the partnership with the not-for-profits, the other large organizations, our relationship with Arthrex has just strengthened over the last 6 to 7 years. Very engaged with them related to our medical device industry course that I still get to teach. They keep my teaching career alive here as dean. But in seriousness, the opportunities that class, that badge and micro-credential that a student receives will guarantee them an interview with Arthrex. So to that point, as a regional comprehensive institution, we serve our region, our 5-county region. We're doing great things here, and now we're becoming more statewide known and nationally known for what we're doing. And it's just a beautiful opportunity. I've been at other institutions and other places, but the relationship that this university has with its local community is one that I don't think is paralleled anywhere. And to your point, individuals knew we needed a higher education institution here. And we've grown together with our community, and it's been exciting to see that connection. As you walk around campus here, there's not many alumni names on buildings. It's community partners that saw our opportunity, invested in us, and now, as a 28-year-old institution, we're giving back in ways that is making it the greatest place to live and work here in Southwest Florida.
And, I didn't realize when I first came on board with the university that a lot of the instructors in the college, they give of their time and actually work within the community 1 day a week.
Many of those are required from their own licensure requirements. Specifically, nurse anesthesiology requires you to maintain clinical practice, but it also allows our students to be learning still from people that are practicing in their profession, and they're very relevant. So they're coming from the clinical experience right into the into the classroom, and not for nothing, we have several great adjuncts that are still in clinical practice that comes back and provides those other experiences for our students as well. So it's a living laboratory, and we would not be where we are without all of our clinical partners. It's a relationship that, as they invest their time in training our students, they're winning as well because they're coming to work for them at their hospital or not-for-profit organization.
Speaking of living laboratory, I think Marieb Hall has some of the best lab spaces on campus. Some, because we have amazing lab spaces all over campus.
Yes.
And
I'm a little biased, though.
I'm not going to play favorites. But we do have cutting edge technology in these, giving them that real life experience before they go and treat actual live patients.
Absolutely. And we've really evolved. I can tell a little story. When I got here in 2005, we had a hospital room. We had a hospital bed. We were sharing that between nursing.
One.
A. We were sharing that between nursing, physical therapy, occupational therapy. At the time, we had an athletic training program. That's where I came involved. That's my background, athletic training, sports medicine. And we would get into this room and have to share. And we were in Ben Hill Griffin building. I remember carrying tables that folded up into classrooms and now what's Merwin Hall. And we would move desks out of the way and put the tables up to do orthopedic assessment. So to see how we've grown from a single room, and we're still training people greatly there, and we made it work, to where we've moved into Marieb Hall, as you alluded to, with all the dedicated lab space, specifically designed for the training and the great education that the students are receiving, to now moving to AB10 as we design that building. The whole second floor is going to be designed to be about 22,000 square foot interprofessional simulation center. So we're just elevating that even more. The training opportunities that the students will have. I will be putting these educational resources up to anyone that has a medical school. It'll be beyond that. And we're just really thankful for all the supports, both from the philanthropic support of the Marieb Foundation, the state support. But yeah, it's a really exciting piece, Katie.
Let's talk about some of that technology a little bit. You've got some really cool gadgets right now. I know you're going to get some more. And you're building out to then also in the new building, not only put that newer technology, but then expand it as it becomes available.
Absolutely. And I think, one challenge that we talked about clinical partners is the training in the clinic side. Hospitals get very busy. It's another burden, to training students. So we're trying to do as much as we can to have them, clinical placement ready, job ready in the classroom. So one technology that we're really excited about, which we have purchased, we've got it crammed in rooms right now, is our hologram technology put out by Proto. And we have a studio where we can record individuals and then live beam them into the hologram. But what's even more exciting is that out in a clinical setting, we'll be able to record patients that we see. Now, make sure that we're following HIPAA. We're not going to violate anything here, our patients' rights.
Right.
But we'll be able to record these individuals and create if you will, a file system of patients so that every student that comes through nursing, physical therapy, occupational therapy will be able to be exposed to that same patient. But prior to this technology, we would have to bring that patient into the lab setting to be viewed. And that can be challenging, especially with some special populations, maybe individuals that have some, antalgic gait or some challenges with walking or whatnot. And so here, though, we'll be able to build a file system.
And you can go to where they are.
And bring that to our students. And it's very exciting. We can do neat talks as well. We can live stream a speaker from around the world through the hologram. So it's going to revolutionize areas. I think the immersion rooms that we're going to place into the new Sim Center as well to really make you feel like you're in an OR with smells and the sounds is going to be phenomenal. And really just upping our game with simulation and, having a dedicated director now, Dr. Joe Buhane. He's an expert in this area, and we build his staff out. It allows our faculty to do what they're great at, is obviously teaching and assessment, and not have to worry about getting the labs up and running. And we can have an expert running those labs so that we're further training our students to the highest quality.
Speaking of Joe Buhane, he has started something on campus the past couple years, Disaster Day.
It's not a disaster.
It is not a disaster. Right. It is a simulation.
Correct.
And something, it's not 3D, it's not AI. It is really simulating real life using actors on campus, using our campus partners, and using our partners out in the community to come in and simulate a potential disaster and how would we respond, and really training those students. And something I found interesting is one of your research pieces or presentations, you talked about moulage and its importance in simulation and training. And what is moulage?
Moulage is essentially makeup, fancy word for that, but to make it authentic.
Injury makeup.
Injury makeup,
right?
Absolutely.
And it looks real.
It's authentic, from those days of the Friday the 13th and the Freddy Krueger movies. We have some really good Hollywood individuals here that can make a wound look very authentic. What Joe's doing with our art patients and creating authentic patients has been just a great opportunity for our campus community. Our local EMS has been engaged. The Florida Guard's been engaged. Last year we had the emergency response team from the state level was engaged. When Joe came, he's like, Shawn and his supervisors, Dr. Beth Murray, our associate dean in the college, is like, I want to do this interprofessional simulation experience. And we're like, okay, Joe, you're new, go ahead and get started. We had 800 people here the first year.
Huge.
It was huge. And I'm like, all right, we got a little big. And he goes, well, I did something. I researched, I think it was Texas A&M or Texas Tech, one of the Texas schools. And I simply got a lot of their playbook, and I'm going to add on to that. I'm like, Joe, we can just pilot it here. And it went off without a hitch. Great engagement from everyone.
Now, it was smooth in terms of disasters and how disasters go. But again, it was a simulation, and it really felt authentic.
It is a very authentic experience. And that's what's important is, for simulation to function and work, you have to suspend that disbelief, and you have to be engaged in that opportunity, and that's what he's created this past year. Once again, Lee County EMS, they had the helicopter land on the fields. I know probably UPD and all of our campus partners, they're like, oh, here comes Joe. But no, in seriousness, everyone on this campus comes together for the day. The alerting of our local community is important because we don't want the
ambulances.
Yeah, we don't want to see the 911 system get overloaded that day. But, a lot of great work from the comps team to UPD to make this work to create such an authentic experience for our students, our faculty, and our staff.
It's something they could experience here. We've seen it, Irma, Ian, our hurricanes, right? And so we can and we do experience large-scale kind of disaster events that could potentially lead to a very large medical response. And so making sure they know what to do and they're prepared is truly important.
It's critical. I mean, those type of days, no pun intended with disaster, they're very chaotic. And part of the learning is everything's going to be planned out in an educational plan that day, and you got to kind of roll with the flow and really understand. And then after that, they debrief and describe, hey, what went well, what didn't go well, why did you triage that patient, why didn't you triage that patient? And it's a great learning experiences that will continue. I think he's got a date for November 2026 already. And then we really want to add to that from moving it from a on the field type experience disaster, then to relocate into a hospital setting as well. So stay tuned, because we may be turning Marieb Hall into Marieb Hospital for November 2026.
Super exciting. But I feel better as a citizen knowing that the students that we are training really have the experience needed to work in that real world environment.
And I think that's the crux of what we do, not just in the Marieb College, but I think you look across campus. Our students are engaged with our community. They're getting authentic, real-life experiences. And I think that's the FGCU difference here. And we wouldn't be there without our community.
So let's go a little bit into your background, athletic training.
Yes.
Were you always interested in sports? Were they always important to you?
They were. I'm an only child, so I grew up, with a lot of expectations on myself.
In West Virginia?
In West Virginia, absolutely, small town West Virginia, and so very proud to have, moved from there to here. Never thought I'd be a dean by no means, but it was sport was very important. Not forced by my parents or whatnot, but I played baseball, I wrestled some, and it was an important as a structure. And then as I got into athletic training, sports medicine, being around Division I football for several years, I think really shaped me as a person. It showed that you always got to continue working hard to get where you need to go. Whatever happened on Saturday was great for last Saturday, win or lose, but how do you pick yourself back up and move forward? And I think that's how I face most of things each day. We give it 100% our efforts, but not everything goes right. And, how do we learn from that and move on? And that's important in healthcare because, there are going to be events that don't go as planned. And then you sit down, debrief with your team, and how do you move forward? And I think that's just a good lesson in life that, a person once told me, you're never as bad as you are, you're never as good as you are, but just keep working hard. And it'll continue to evolve.
What have I left out that you want our viewers and listeners to really take away from this conversation today?
Well, I think that hopefully they see the passion that we have here for our university and their university. I think the other aspect is that the Marieb College of Health and Human Services is very proud to produce the type of graduates that we produce. They're not one person producing them. We have phenomenal faculty and staff that comes to work daily and strives daily to make that happen. And we're also proud to watch our students, come across the finish line, come across the graduation platform, and then come and take real critical jobs here in Southwest Florida that's going to further drive the community that we love and live in. I've been down here since now 2004. I did have a little one-year hiatus over to Florida International University, but we stayed in Southwest Florida. We found a home here, and so everything we do each day is to make this home the best place for everyone here in Southwest Florida.
And that's what this university, your university, is all about, right?
Absolutely. Absolutely. It's exciting.
It is super exciting. I really challenge everybody next time they go into any sort of doctor's office, healthcare office, whatever it may be, ask how many of the people that work there are FGCU graduates, because I think they'll be surprised.
Yes. I think, as you age, you all have to do preventative procedures. And at my most recent preventative procedure, there were 2 FGCU grads there. And one was a former student. So it's exciting to know that we've well-trained, people throughout our college has had that same experiences as well. And as I said, they're taking jobs here and taking critical jobs here in Southwest Florida. And we're everywhere. And not just within the college, but across our campus and all of our colleges. It's exciting that we're really meeting a need here in Southwest Florida, and to see what FGCU has done for our area, it's been one of the largest drivers ever. It's a story in itself.
So come on out to campus, see what we're doing. Take a look at Marieb Hall, see the artwork, take a walk along Academic Row, see the names on the buildings, learn more about it. How else can you tell people to get involved?
I would just suggest come by over the next 2 years as we're building AB 10. That's going to be fun to see that come out of the ground. The ground's cleared right now. It's going to be next to the art complex. So grab an art show and take a peek at where the building's going to go and keep coming out and seeing it grow. It's a history making.
I love that history making. We're still growing, we're still expanding, and we're still breaking new ground. Shawn Felton, Dean of the Marieb College of Health and Human Services, thank you so much for being here.
Katie, it was my pleasure. Thank you so much as well.